In our studio, Dr. Joe Congeni, Akron Children's Hospital, Sports Medicine Center. And Joe, something you pay very close attention to, and that's the latest information, research coming out pertaining to the word concussion. And you're going to hit that again for us today.
Yeah, we don't want to overly emphasize that, but a big one last week on Valentine's Day, a week ago today, was the FDA, 1 week ago, 2/14, approved a blood test for diagnosis of concussion. This blood test that we know has been in the works. It's been in the pipeline for a couple of years. A lot of these studies, Ray, when they do them at the DOD, the Department of Defense, and the Pentagon paid for this study. They really want, from their standpoint, they wanted to find a blood marker. And in the last couple of years, they thought the test looked pretty good, and the FDA wanted to show that it wasn't moving slowly. It moved really quickly. It took everybody by surprise when it came out last Wednesday in the medical field. We thought, wow, this is still a few years down the road in the pipeline, and here they approved it last week. So most of the studies were in adults. Most of the studies were in the Department of Defense, but now in the sports world, what kind of role is it going to play? So these two blood markers that are released with injuries to the brain, they're released into the bloodstream, so you can do blood tests fairly early on, like in emergency room, a couple of hours after somebody's injured, and see whether the brain is concussed and make a diagnosis of concussion. So what they're purporting it to be, and I'm a little surprised the FDA jumped the gun even on what they're so excited about what it's going to do. Number one, they think it'll really cut down on the number of CAT scans that need to be used in emergency rooms. So when people go to emergency rooms, they get CAT scans to help diagnose. But remember, CAT scans don't even show concussion in a lot of situations. But CAT scans are way more expensive, $1,500. This test is $150, the blood test. So they think it'll save a lot of money, a lot less radiation, 1/3 less CAT scans would need to be done. So they're really excited about that aspect of it. But 90% of the time when we in the sports world diagnose concussion, it's a clinical diagnosis. We don't even send people to emergency room, and they don't get CAT scans. So I'm not sure about how much usefulness with that, number one. Number two is all those cases that slip between the cracks where kids are probably concussed and we just don't know. Now we could send them afterwards to, get a blood test done in an emergency room or even perhaps in a laboratory setting and have a definitive diagnosis within 24 hours. So that could be really beneficial rather than letting kids run around who are concussed, the risk of second impact syndrome and all that kind of stuff. So those are the two really exciting things about it. But like everything else, there's a lot of questions about it, too. Right now, it's only in adults. They didn't test kids at all. So for the next couple of months, they've got to test kids before we're going to be able to use it in the high school setting and stuff. This issue of the subconcussive hits, we don't know. They're looking at a new marker where they combine these two blood tests, and maybe it'll be more sensitive and pick up kids that have taken a lot of those lower level blows that are not a full concussion, but kids that probably ought to be sitting out. And the other thing it would be they're working on is a digital sideline component where we could actually do the blood testing right there on the sidelines, but they're not there yet either. So there's a lot of questions, a lot to be worked out. Everybody was taken aback a little bit that they really pushed it through at the FDA and approved it right away a week ago last week. And it was pretty on the fast track at the FDA.
The thing that I like about the whole thing was the idea of those cases that are on the bubble a little bit.
Yeah.
Concussed, maybe not, maybe just a blow to the head. This will kind of get in there and take care of that. Medically, talk to us a little bit, without getting too medical on it, what happens in this study to the blood with a concussion?
Yeah, it's just very, very simply, they looked at 4 biomarkers in all these studies in the last couple of years at the DOD, Department of Defense, and 2 of them came to the top as the ones that really are proteins that are released when there's injuries to brain cells.
Gotcha.
So when there's injuries to brain cells, you break apart the part of the brain cell, and this protein is released. They looked at 4 of them, and 2 were the 2 that really came to the forefront. And over 90% of the time, versus people with orthopedic injuries they tested as a control, they didn't have any increase of these markers. And the people with concussions, 97% of them had positive. These 2 proteins went way up in the bloodstream. So because of damage to blood cells, these markers go up. Now, they also said 99% of the time when this number was normal, the brain would be normal, and it may save us doing CAT scans in the emergency room, which are expensive and also have a lot of radiation. So they're excited about that. But much of the time, we didn't do CAT scans anyway. So that part has us scratching our head a little in sports medicine circles.
All right. Dr. Joe Congeni, Sports Medicine Center, Akron Children's Hospital, join us pertaining to concussions.
You know
Anything
that
else
I
on
will.
your list?
You know that I will keep you updated because there's a lot to learn, and as we start to use it in the first few months, and there's a couple new products that they want to roll out, we'll keep you updated as the most informed radio audience in the Midwest for sure. Your audience, we'll keep you updated as to what's going on and talk about some of the other things going on. And we're really hoping you have a great week down there at Wahoo Week and get that team in order because they're telling us the window may be closing in Cleveland.
I'll crack the whip on them, Joe.
Crack the whip and get the window opened a little bit wider. Forget the Yankees this year. This is the year of the Tribe.
All right. Thanks, Joe.
All right, right.
Dr. Joe Congeni, Sports Medicine Center, Akron Children's Hospital, joining us live in studio.